we are home to all sorts of materials, artifacts, papers, photographs, rare books. And so if we ever get past this COVID-19 pandemic where we can open back up, I encourage you all to come down, and I'd love to give you a tour of the facility. And speaking of the pandemic, if you do have any materials that document the pandemic, how you experienced the pandemic, maybe through photographs or journal entries or short stories, or however you you have gotten through this pandemic, I'd like to encourage you to donate those to the Historical Research Center at some point. In the future, there are going to be historians who are very interested in how we dealt with the pandemic and how we dealt with quarantines and things like that. The Society for the History of Medicine and Health Professions, as I mentioned earlier, is the sponsor of this series, and they are, if you're not a member of the society, I hope you'll consider joining. The membership dues are reasonable. They're not fairly reasonable, they are reasonable. $15 for an individual, $5 for a student membership. And that means you can be a student at any institution in Arkansas. You don't have to be a student just at UAMS. You could be at Fayetteville, you could be at Arkansas State, wherever. So I hope you will consider joining us. There's a link on your screen. There's the really long URL, which will take you to the society webpage. But if you want to skip all that and just go to PayPal, you can go to paypal.me/shmhp, and you can just pay online. And then we'll get you on the mailing list. And usually we have an annual dinner and a lecture. Of course, we couldn't have one last year because of the pandemic. This year we're hoping to have it in the fall, so I'll keep you posted on that. Couple of things to mention, and you probably have memorized this if you've been to any of these lectures before. Everyone is muted and your video is also stopped. But you have an opportunity to ask questions if you want to just use that chat button that's located in your menu on your taskbar. Please do so. You don't have to wait till the end to ask questions. If you hear something as I'm talking or as I'm speaking, please feel free to just chat, write your question in that chat box. I am going to be your speaker tonight, and but before we get to that, I want to alert you to the next month's stay-at-home lecture. It's going to be by Kathleen Condrey. She's in the Department of Foreign Languages and Cultures at U of A Fayetteville, and she's going to be talking about medicinal ads in the Arkansas Echo. The Arkansas Echo was the German language newspaper published in Little Rock from about 1892 to 1935, I believe. That is, if you were at one of our society dinners a few years ago, Dr. Condrey gave that lecture, and she's going to repeat it, maybe tweak it a little bit, but it's a very interesting presentation. So I hope you'll join us next month. As I mentioned, I am going to be your speaker tonight, and I'm going to be talking about female healthcare leaders in early 20th century Arkansas. We hear a lot about some of the female leaders in Arkansas, in the Arkansas health sciences. Of course, we're familiar with Dr. Edith Irby Jones, Dr. Joycelyn Elders, Evangeline Upshur, a dentist here in Little Rock, but you rarely hear about the women in the late 1900s, early 20th century, or late 1800s, early 1900s. So I'm going to talk a little bit about those people that I found, and this, by all means, is not an exhaustive list. I am still gathering information because I think it is really important that we find these women and preserve their histories and what they accomplished and how they contributed to our knowledge base today. So let's go ahead and get started tonight. I'm going to talk about first Dr. Annie Shopik, and I'm glad to see Dr. Richard Clark on tonight because he's written a history in the Pulaski County Historical Review on Dr. Shopik. But Dr. Shopik She was the first female graduate from the University of Arkansas, the medical school, what was then University of Arkansas School of Medicine, or medical department probably. And she graduated in 1901. She was the first female admitted to the university. We'll hear about another woman who tried to be admitted before Dr. Shopik, but Dr. Shopik, a wonderful doctor. She specialized in gynecology and nervous diseases. You can see she had an ad in the newspaper. Maternity cases a specialty, also nervous diseases and diseases of women and children. And her office was on State Street. By all accounts, she did not have an easy time in medical school. The stories that have been told say that she wasn't treated very well. There were a lot of pranks played on her during her time, but she did persist. She did graduate in 1901. The newspaper, the Arkansas Democrat in 1901, after the commencement ceremony at the medical school, mentions that apparently there was an excessive rainfall that night, but it says there were 20 graduates in the 1901 class, including a Little Rock young lady. And so she has that distinction of being the first female graduate from the University of Arkansas. As I mentioned, Dr. Richard Clark has done extensive research on Dr. Shopik and actually was able to get a gravestone, a memorial plaque in Oakland Cemetery designating her as the first female graduate. Her son also graduated from the medical school, I believe is in 1912, and he later went into practice with her. And I mentioned earlier about another woman who had tried to be admitted to the medical school before Dr. Shopik, and that woman was Ida Jo Brooks. Ida Jo Brooks, she was a native of Little Rock. Dr. Shopik had been born in Canada, but Ida Jo Brooks was the son of Joseph Brooks. And if you remember your Arkansas history, the Brooks-Baxter War during Reconstruction, she was the daughter of Joseph Brooks in that skirmish about the gubernatorial race. So she tried to be admitted to the university, to the medical school in 1893. She was rejected because of her gender. So she ended up going to the Boston University School of Medicine. And the Boston University School of Medicine was actually one of the first universities in the country to accept women. She graduated with her medical degree in 1891. I misspoke earlier. She tried to get admission to the medical school in 1887. So she graduated from Boston University in 1891. And she was more of a homeopathic doctor. And she specialized in psychiatry. And she actually stayed in Boston until around 1903 when she returned to Little Rock, and she opened up a private practice for pediatric patients. Now, interestingly enough, so you'll remember that she was not admitted to the medical school in 1887 because of her gender, but in 1914. She became the first female faculty member at the university when she was hired on the lecture for social hygiene in the psychiatry department. She was also a big advocate for women's rights. She tried to run for superintendent of public instruction right after Arkansas passed the suffrage, gave women the right to vote, but she was marked off the ballot because the judge ruled that even though women had the right to vote, had been given the right to vote, that did not necessarily mean that they were given the right to hold public office. So she was actually taken off the ballot. And she was, the Republican Party nominated her a few years later, but she did not run. She concentrated on her private practice. In 1918, she was called over to help with the influenza epidemic at Camp Pike in North Little Rock. And she was a big advocate, not only for women's rights, but also for children with mental deficiencies. And so she really advocated for education for those children, and established a school in the basement of what was then Kramer's School in 1913, which became one of the first of its kind in the state. So Ida Jo Brooks is another fascinating woman in the healthcare in Arkansas. And on your screen, you'll see the old State House there. Of course, those of you who are familiar with the history of UAMS know that the School of Medicine, the medical school, was located in the old State House from 1912 to the mid-1920s. Next, we're going to talk about another UAMS individual, Dr. Molly King. And Molly King was originally from Indiana. She received her medical degree from Indiana University School of Medicine. She graduated in 1915. And the article in the Indiana newspaper says that she was, she will be, after her graduation, she will be known as Dr. Molly King in a class of 40 college graduates. She received the highest grade in that grade among those other 39 people, having attained an average of 947% out of a possible 1,000. She interned at Robert W. Long Hospital in Indiana, and she passed the medical registration. And she was eventually recruited to come to the University of Arkansas, the School of Medicine, and where she became chair of the pathology department. She also headed up the state hygienic laboratory, but she only stayed a brief time in Arkansas. She left in 1920, and she passed away only 10 years later in 1930. And from what the newspaper described as exposure during her work and overwork. So you take that for what it's worth, but she could have done great things had she not died. She did great things while she was alive, and she could have accomplished much more had she not died at such a young age. The next individual we're going to talk about is Mamie Hale. Mamie Hale was a midwife. She worked for the Department of Health from about 1945 to 1950. I know I'm pushing it a little bit on early 20th century, but Mamie Hale really did a lot to bring safety practices to the rural population in eastern Arkansas and the Mississippi Delta. And she helped to train a number of midwives in that area, and really contributed to the implementation for better, safer practices for home births. And you can't really you have to give Mamie Hale a lot of credit for her work with the people over in the Arkansas Delta for their, and especially for the African American community. Now, in the mid 20th century, midwife births were more common than they are now. Of course, they're sort of making a comeback now, but there were only about 25% of births that were actually in Arkansas hospitals. And so a great number, the vast majority of babies were born at home. And a lot of these people used midwives. And so Mamie Hale worked for the Arkansas Department of Health. She went out, she held training classes for midwives, and really taught them, as I mentioned, the procedures and practices, sterilization, the importance of sterilization of instruments, having a clean environment, things like that. So she cannot be overstated, her importance to the midwife movement, to the midwife, I guess movement is probably the right word, in Eastern Arkansas. And so not enough research has been done on Mamie Hale, and I'm hoping at some point that someone will do more research on her. Another person I want to talk about is Lena Jordan, a nurse here in Little Rock. She was instrumental in providing health care to the African-American community here in Little Rock. She, in the 1920s, 1930s, she established the Lena Jordan Hospital. She got her start, though, at the State Mosaic Hospital, which was the hospital unit of the Mosaic Templars fraternal organization. But she herself trained a number of nurses at the Mosaic Hospital. She opened up her own hospital, as I mentioned, and really provided care for the African-American community that was lacking here in Little Rock. Of course, the African-American community has always received substandard medical care from the white community. And so she really stepped in along with other African-American doctors and African-American nurses that I'm not mentioning here today. But Lena Jordan really did a lot to provide medical care for people who normally would not have had access to it. So she did amazing things here in Little Rock. Next, we're going to move over. We're going to talk about Emma Smith, and Emma Smith is an interesting person. She graduated in 1915 from Natchez, Mississippi Training School for Nurses, and she became sort of a private nurse where she basically worked 24 hours a day in homes. She described one man she was working with who had typhoid fever as quote, horribly sick, just horribly sick, and stayed sick. He just looked like he was going to die, end quote. And so that was her sort of her trial by fire into the nursing career. She joined the American Red Cross in 1917. In 1918, she accepted the call for nurses to help in the military camps for the soldiers who were fighting the influenza epidemic, the Spanish flu of 1918. And after that, in 1924, she and her family moved to Little Rock. She said that her decision to follow her family here to Little Rock was a primary reason for settling here too. So once relocated, she was hired by the Arkansas State Board of Health, whose director was Dr. C.W. Garrison. And Garrison was instrumental in the 1918 flu, state health officer, working with the U.S. Public Health Service in combating the 1918 flu. Smith and another a nurse who unfortunately I couldn't find a picture of, so I didn't include her in this one, but Lenny Beecham traveled in units in sort of mobile in cars around the state, and they conducted health screening for children and educational programs for adults. So they would go out, they would do these training sessions for adults on better hygiene, things like that. She was Smith, as a nurse, she was also involved in 1927 when Arkansas had the 1927 flood, which devastated most of Arkansas. And she happened to be up in Northeast Arkansas at the time, at one point during the 1927 flood, and she actually got marooned in Hardy, which is on the Spring River. And so she got stuck in Northeast Arkansas. And after she left, she got out of Hardy, she came back to Little Rock. They sent her over to Forest City to provide medical attention to the folks in Forest City in eastern Arkansas. So Mary Emma Smith, a very interesting nurse, an early nurse in Arkansas history. Another a doctor from Fort Smith actually is Dr. Minnie Sanders, and Minnie Sanders is interesting. She doesn't look very happy in that picture on the left, but she was born in Illinois in October of 1867. She graduated from medical school in Illinois in the late 1890s. She came to Fort Smith and often worked in Fort Smith, and she went over into what was then called Indian Territory, Oklahoma, and she treated smallpox, and she was quoted as saying she treated smallpox, she rode side saddle and walked in the mud and in the dust of Fort Smith's streets. And many people actually called on her specifically to help treat their ailments in Fort Smith. She was actually, while she was in Illinois, she was actually became the first female juror in the world, and that happened in the 1880s, I believe, where she was sat on a jury, and that was one of her claims to fame, is that she was the first woman to ever sit on a jury, supposedly in the world. I don't know. I didn't verify that, but she didn't. After she moved to Fort Smith, she didn't practice very long. She married while here in Fort Smith, and she retired after she was married to focus on raising a family. But she still had contributions to the healthcare history in Fort Smith and on the border in Oklahoma. And can you imagine what it was been like back in the late 1890s, early 1900s in Fort Smith and in Indian Territory, Oklahoma, for a female doctor? I find that amazing that she was actually able to do that, and that she was accepted at that time period in Fort Smith, which would have been a rough environment to be in, even for a man and especially for a woman at that time. Next, let's talk about Elizabeth Chaplin. And she's interesting because she was the only Arkansan to serve in the Spanish-American War. She was born in 1871 near Sweet Home in Pulaski County, and she attended Arkansas Female College in Little Rock, which was in the Pike Fletcher Terry Mansion downtown. She attended nursing school at Chicago Baptist Hospital in Illinois, and when the Spanish-American War broke out in 1898, she was too young to be admitted for enlistment, obviously, but she was admitted as a contract nurse, and she served in Florida and in Panama City, in Fernandina, Florida, and at Camp Cuba Libre in Panama City. She was one of 1,700 volunteer nurses to serve in the war, and as I mentioned, the only Arkansan to do so. She married a man from Little Rock, last name of Herndon, in 1922, and they lived here in Little Rock. After the war, she served as president of the United Spanish War Veterans Auxiliary, and she was elected vice president of the Spanish-American War Nurses. She continued her medical practice, or her being a nurse here in Little Rock after that. And she died in 1957, is buried in the National Cemetery. Next, let's talk about Vinnie Middleton, who was a nurse. She is best known for working at the Logan H. Roots Memorial Hospital. This is not the Roots, Fort Roots that we know in North Little Rock, but instead a hospital in downtown Little Rock. So in 1898, the mayor of Little Rock formed a visiting board to help support the new Logan H. Roots Memorial Hospital. It had been built in 1898. It was named after Logan H. Roots, who had also given a lot of money to support the hospital. 1899, Dr. H.F. Minturn was superintendent of the hospital, but they had a hard time attracting nurses to the hospital. So in early 1901, Vinnie Middleton, who was a graduate of St. John's and Bell Point nursing schools in Fort Smith, and I'm going to mention those again a little bit later, came to the hospital as head nurse. And while she was here, or at the hospital, they asked her to organize a training school for nurses, which she set up. So one of the early training schools in Little Rock for nurses. Now, Dr. Minturn, who had been superintendent of the Roots Hospital, left shortly thereafter. And so then the mayor asked Vinnie Middleton to become superintendent of the Logan Roots Memorial Hospital, which she did. Interestingly enough, the student nurses, when she was head nurse and she was set up this nursing training school, one of the women who was training to be a nurse was a sister of Bernie Babcock. And Bernie Babcock, if you don't know, an author, really a civic leader in Little Rock. She helped found the Museum of Science and History, which eventually became the Museum of Discovery. But Bernie's sister Beulah did not finish school because she had to withdraw from the school because she had a skin allergy from the disinfectants that were used at the school, which I found found interesting. She stayed until about 1902, so she didn't stay a long time at the hospital. She resigned to go to the Memphis City Hospital, but she was succeeded by another nurse, Miss Newton, eventually Logan H. Roots Memorial Hospital, the name was changed to just the City Hospital. And of course, later on, Fort Roots was also named after Logan Roots. So I mentioned earlier about some of the nursing schools, but you can't talk about the history of women in healthcare in Arkansas without mentioning the religious communities in Arkansas. On your screen now is the Oliveton Benedictine Sisters from Jonesboro. If you were here at the stay-at-home lecture in December, we had or November, I believe it was, we had a presentation on the sisters and the founding of St. Bernard's Hospital in Jonesboro. The Oliveton Benedictine Sisters originally were from Switzerland. They came to Northeast Arkansas in the late 1880s. To Pocahontas. During an outbreak of malaria, they were asked to, in the 1890s, they were asked to tend to the sick. That in turn resulted in the establishment of a hospital St. Bernard's was founded in 1900, and they continued to provide medical care to Jonesboro and the surrounding areas up until recent history. They're still affiliated with the hospital in Jonesboro, but they don't have as much of an active role in the hospital as they once did. But the healthcare in Northeast Arkansas would certainly not be what it is today without the Olivetan Benedictine sisters in Jonesboro, coming from Switzerland to Pocahontas and then moving to Jonesboro in the late 1890s. And like others that I'll talk about here in a minute, the establishments of these hospitals were almost always related to some sort of epidemic or some sort of medical crises that was happening at the moment. And the sisters, these religious sisters, stepped up. Most times they had no medical training whatsoever, but they stepped up and they offered comfort and healing to the sick, and in the process built some of the first hospitals in Arkansas. Training schools, of course, all the hospitals eventually would have some sort of training school for nurses. St. Bernard's was no exception. Their nurses training school began in the 1920s, which was relatively late in the setting up training schools for nurses. But nevertheless, that was my mom actually went through the training school in the 1940s or 1950s, excuse me. And so that was how they were able to keep those hospitals open, because they had these schools, and then when the nurses graduated, they were able to go immediately to work in the hospitals and get their training at the hospitals. That was also true not only in Northeast Arkansas, but also in the western part of the state. St. John's Hospital in Fort Smith actually has the distinction of being the first permanent hospital established in Arkansas. It was established in 1887 in Fort Smith. Before that time, there had been previous hospitals, but they were always temporary hospitals. They were never considered permanent. An example was the U.S. the military hospital in Little Rock during the Civil War, out of St. John's College in the old St. John's College over by MacArthur Park. So St. John's Hospital in Fort Smith in the late 1880s. There was some need for medical attention. A man broke his leg. There was no one really to tend to him. So the women of Fort Smith tended to this man who had a broken leg. And in the process, they decided they needed to have a hospital built. It was established along with the Catholic Church in Fort Smith and St. John's. Eventually, St. John's Hospital merged with another hospital, Bell Point Hospital, to become Sparks Memorial Hospital, which is what we know now in Fort Smith. As with St. Bernard's Hospital, St. John's, Bell Point, they actually started the first nursing school in 1895. The earliest graduates of Bell Point School, Dolly Sieber from Carthage, Missouri, Irene Adlet from Little Rock, and Ella Woods from Fort Smith. Nurse Adlet would actually become instrumental in establishing the Arkansas State Nursing Association in the 19-teens. And like, their training facility established in it was the earliest nurses training school in Arkansas, which makes sense as it was the earliest permanent hospital. But they too turned out a large number of nurses who in turn impacted healthcare in Arkansas, not just in Fort Smith, but across the state as well. Speaking of hospitals, we can't talk about hospitals and the establishment of or the influence on healthcare without talking about St. Vincent's Hospital in Little Rock. It was the second permanent hospital established in Arkansas. It was established in 1888, a year after St. John's Hospital in Fort Smith. St. Vincent Hospital was established by the Sisters of Charity of Nazareth out of Kentucky, and they came to Little Rock to establish St. Vincent Hospital at the urging of Bishop Edward Fitzgerald. And the Catholic Church had received, and the reason for this was because not only did the bishop see a need for healthcare services in Little Rock, but the Catholic diocese had also received had been bequeathed money in Alexander Hager's will. And when the yellow fever epidemic hit Memphis in 1878, 1879, people were afraid that it would move over to Arkansas and wreak havoc on Arkansas as it did in Memphis. And the Hagers here in Little Rock made a pact with God, and they made a promise to God that if God allowed the yellow fever to pass over Little Rock and to spare Little Rock from yellow fever, that they would give money to found a hospital. So after the Hagers died, in their will, they gave money to the Catholic diocese, which in turn became St. Vincent Hospital. When it was initially established in 1888, it was just known as Charity Hospital. And then a few years later, and they changed it, or they had it for Charity Hospital because they didn't want the religious designation to turn people off. A few years later, they changed it to St. Vincent, and of course now it's CHI St. Vincent. But the Sisters of Charity of Nazareth are still involved in St. Vincent Hospital. St. Vincent's also established a training school for nurses, like many of the other hospitals around the state, including Baptist State Hospital here in Little Rock, established in the 19-teens, 1920s, and their training school for nurses. Of course, they have Baptist Health College now, which trains a large number of nurses. So let me catch up on my notes. While 1924, the Baptist Hospital had its first graduating class of nurses of 17 people in the mid-1920s. So you have St. Vincent's churning out nurses. You have Baptist Hospital churning out nurses. You have St. Bernard's up in Northeast Arkansas. You have Fort Smith Hospital churning out nurses. You have St. Joseph's in Hot Springs, who also is affiliated with the Sisters of Charity of Nazareth, who also have which also has a nursing training school. So you have all these hospitals around the state that are just putting all these women into the healthcare profession through nursing. But the white institutions were not the only institutions that were training nurses. We talked about Lena Jordan earlier, and she was at the Mosaic Hospital training nurses, but you also had Fred Jones, Dr. Fred Jones, and his hospitals, the Great Southern Fraternal Hospital in Little Rock in the 1920s. They had a nurses training school there as well. And both of these hospitals, the Lena Jordan Hospital and the Great Southern Fraternal Hospital, they were all located on the west side of Little Rock at the 9th and around 9th and Chester, which was considered that's the predominantly African-American area of Little Rock. So Fred T. Jones, he was a native of Louisiana, moved to Little Rock, established the Great Southern Fraternal Hospital in Little Rock, one in Pine Bluff. He also helped develop the insurance plan, whereas people would buy insurance for future medical costs. And his nursing training school was very successful and trained a lot of the nurses that worked in the other African-American hospitals in Little Rock, including the Lena Jordan Hospital, the United Friends Hospital. United Friends was also another African-American fraternal organization here in Little Rock. So let's switch gears a little bit and let's talk about a pharmacist. And this pharmacist, Isabel Davis, she is from my home county of Perry in the large town of the big town of Houston, Arkansas, which if you're familiar with, Perry County is located between Bigelow and Perryville. At the time, Houston was established or had a boom in the population around the 1899, 1900, early 1900s, when the Choctaw Railroad laid down tracks through Houston and north of Perryville. And so the town grew up around the railroad track. And of course, when you have a town, you have to have facilities and stores and all sorts of things for this growing population. And so Isabel Davis, she was the pharmacist. She was one of the first pharmacists to be registered in Arkansas, and she was registered in 1903. Now, at the time, there were not very many women pharmacists in the U.S. An estimate, 1901, they say that there were only 400 women pharmacists in the U.S. at that time. But as I mentioned, Isabel Davis was registered in 1903. That was the re-registration. There was a new law passed that said that a pharmacist had to be re-registered even if they had already been practicing. So she had been practicing before 1903, but she was one, when they re-registered people in 1903, she was one of the earlier ones to do that. There were other women early on to be registered, including one that I'm going to talk about here in a minute. But even in 1891, there were four women, excuse me, who qualified for registration under the original 1891 Act. Ruthie Pipkin in Little Rock, Marie Cole in Fort Smith, Ann Bellchamber in Eureka Springs, and Martha Lane in Stuttgart. And I just found it interesting that Stuttgart in 1891 would have a registered pharmacist there, a female registered pharmacist. I just found that fascinating. Unfortunately, I was unable to find much information or any information really about these four women from 1891. I'm continuing to do research and I'm hoping to locate more information about them. But you'll see the picture that's on your screen. This was Main Street in Houston, and the third building from the right, the second building with the big facade out front is her drugstore. The drugstore was under her husband's name, but W.H. Davis, but she was the pharmacist in Houston. And she was written up in the history of Perry County. And there's an interesting story about her. It says, in May 1903, Dr. John B. Bond, of course, Bond Pharmacy in Little Rock, president of the Arkansas State Board of Pharmacology, was in his Little Rock office. A young woman stepped into the room and said, "My name is Isabel Davis. I'm from Perry County, and I wrote that I wanted to take the state board exam for a pharmacist license." When asked by Dr. Bond what her qualifications were, the 23-year-old placed an envelope on the desk before him. In the envelope was a certificate issued by the Ohio State University School of Pharmacy. She had been certified by the School of Pharmacy in Ohio. She also was, their house was fairly close to downtown Houston. And the story goes that they had one of the first telephone lines in Houston, which connected the drugstore to the house. So if Isabel Davis was in her house at the time, someone needed some medication, her husband, who often ran the store, would call over to the house and she would come over and mix the prescription up for her. The drugstore, they operated the drugstore until the 1940s, and she lived into the 1950s. But she's a really interesting person, a very interesting person, not only for the history of pharmacy in Arkansas, but the history of Perry County. Perry County is such a rural county, And Houston in 1903, 1904, early 1900s would have been a rough town. And so it's just interesting to me that she was in Perry County, and then Lane, I believe it was, who from Stuttgart in 1891. I just find that fascinating. Another pharmacist woman who made an impact on Arkansas was Maud Duncan from Winslow. Many people think that she was she was the first female pharmacist in Arkansas, and that is not true. But Maud Duncan did a lot of things besides being a pharmacist. She had her drugstore in Winslow. She was also mayor of Winslow for a while. And in fact, she and other women ran the government in Winslow in the 19-teens, and they called it the petticoat government because it was all the city officials were women. But Maud Duncan, she operated her drugstore. She also had interest in civic matters and women's rights. She was a newspaper editor, the Winslow American. It was actually the 1920s. I misspoke. I said the 19-teens. It was the 1920s that she had the petticoat government in Winslow. And one of their accomplishments, one of the accomplishments of that of the petticoat government was that they raised money to build a road in Winslow that went up the mountainside. If you've ever been up to Northwest Arkansas and go through or past the Winslow exit, you'll know how steep it is. But she is a legend in Winslow and Washington County. If you're ever up in Springdale, the Shiloh Museum used to have a really nice exhibit on Maud Duncan, and there are a couple of books written about her. So I encourage you, if you have a chance, to read more about Maud Duncan. I'm running out of time, so I'm going to kind of speed things up a little bit. Talk about Helen Sinclair, who was a nurse at the Arkansas State Hospital for Nervous Diseases, eventually became the Arkansas State Hospital. And she wrote up her report. She was originally from Scotland. She was a graduate of the Royal Infirmary in Edinburgh, Scotland. And in 1913, she wrote up sort of her memoir. And she said, in September 1913, I undertook the organization of the nursing department and the reorganization of the attendance department at the State Hospital for Nervous Diseases in Little Rock. The month of September was devoted principally to a broad general organization of wards, enforcing strict regulations regarding uniforms, establishing a regulation dress for women employed in the domestic department. Some much needed rules were drawn up and enforced. The course for male attendants was not begun until January 1914, and in view of the fact that some of the men were anxious to gain the attendance certificate, I decided to give them every opportunity to do so. Consequently, I had to increase the number of my lectures, so she taught these classes to do so. A number of lectures per week, which was not altogether satisfactory. In all 82 lectures, classes and demonstrations were given. During the second week of May, examinations were held, and on May 27, 1914, 18 women and 6 men graduated as attendants. So she was a really strong-willed woman. She whipped the Arkansas State Hospital into shape. And of course, the state hospital at that time usually was a dumping ground for indigents. People who could not pay their debts were often put in the state hospital. Of course, people with who were mentally ill, but people who also just had intellectual disabilities were placed in the hospital, the State Hospital for Nervous Diseases. So it was not probably an easy job, but Helen Sinclair seems to have done a really good job there. Unfortunately, there's a lot more in her her memoir that I can't get into, but I want to mention that she wrote something for the American Nurses Association Journal, and I'll just read you a few words. The appeal of the insane has surely reached us all. We consider ourselves members of a humane profession, and yet we have almost entirely ignored the cry of the insane. If the mentally sick are to have proper care, that care must be given by the thoroughly trained mental nurse. It is only too true that the mentally sick are left to the care of women who are absolutely unfit to take care even of the physically sick, and are much less fitted to take care of the patient who is suffering mentally. Not only do we need more training schools in our state hospitals, but we must have higher standards in the training schools if the patients are to be properly cared for. So she was an advocate for better care and better conditions at the state hospital. Talk about Arkansas Children's Hospital, Ruth Bell. She was superintendent of the Arkansas Children's Hospital from 1934 to 1961, long tenure there. She was a native of Missouri. Her parents moved to Rogers. She was involved in the Junior Red Cross during World War I, and she came to Little Rock after the war to work with the National Tuberculosis Association for a while. She was really concerned about people who had TB, but also she was an advocate for those who lived in poverty. And so in 1934, the story goes, she came to Little Rock to bring a boy with TB to Children's Hospital for treatment. The boy unfortunately died, but she went to the county judge, who is president of the hospital board, to complain about conditions at Arkansas Children's Hospital. The judge offered her the superintendent's position because the current one was about to move on. So she accepted, and she became the second superintendent of Arkansas Children's Hospital. And as I mentioned, she stayed until 1961. At the time that she became attendant or superintendent, the hospital was days from being foreclosed upon. They needed $30,000. She was able to collect to raise that money. She streamlined the operations of Arkansas Children's Hospital, made a great impact on that facility, really gave it financial stability. And of course, Children's Hospital today is just a important institution in Arkansas. Let's see how much time. I'm running out of time, so I'm going to move a little quickly. We have Catherine Dillon, a nurse. She was president of the Pulaski County Nurses Association. She actually organized the Little Rock Nurses in 1910, and later a Pulaski County Nurses Association in 1911. She was a charter member of the Arkansas State Nursing Association in 1912. She married a druggist, but she continued her nursing activities throughout her life. And we have Bess Michaels Riggs, who is a superintendent of the Arkansas School for the Deaf. Her father went deaf during a battle during the Civil War. So she came to Little Rock. The School for the Deaf had been opened in 1867. She came in 1926. She stayed until the 1950s, really put the School for the Deaf on in financial stability, again, like Ruth Bell and the Arkansas Children's Hospital. The facilities at Arkansas School for the Deaf grew. Number of buildings were added. She instituted a teaching program for teachers of the deaf, and so she was a real leader for children who were normally probably marginalized. And of course, not everyone are nurses or in the healthcare field. That doesn't mean they can't make contributions. Maddie Crawford made huge contributions to the Davis Hospital in Pine Bluff. Davis Hospital eventually became Jefferson Regional Hospital. She was a volunteer, and Jefferson Regional estimates that from 1895 to 1923, that period of her volunteering at Davis Hospital, that Maddie Crawford gave 86,500 hours of volunteer time in getting the hospital running, doing all sorts of things, raising money, getting that hospital on stable financial ground. Just a huge asset to Davis Hospital in Pine Bluff, and of course Jefferson Regional brings so much to the city of Pine Bluff and Southeast Arkansas. So I'm going to leave it there with Maddie Crawford, and I'm going to open it up for questions. If anyone has any questions, I'm sorry I ran a little bit over. Tonight we have about a couple of minutes, so if you have any questions, please feel free to type into the chat. And Lynn, I noticed that you asked, I'm assuming that's probably with the Lena Jordan Hospital that I talked about. And that was all located downtown in sort of the western part of downtown, a little right near on 9th and Chester, right around in that area. So if anyone has any questions, please feel free to put them in the chat box. I know it takes a little bit of time to type something up. If you have any questions, you think about something that later on you're about to go to sleep and you say, oh, I wish I had asked that question. You have my email address on the screen right there. You can just shoot me an email and I will get back with you. Thank you, Mary. I appreciate it, y'all being here tonight. I always enjoy giving presentations, and I'm especially pleased with the way these stay-at-home lectures have gone. I think they've been really good for the society. And have really raised not only the visibility of the Historical Research Center, but also the history of healthcare in Arkansas. If there are no other questions, I'm going to bid you good night, and I appreciate everyone being here. This has been recorded. It will eventually be on the YouTube channel for the society. It takes a little bit of time to edit, and I'm not the best at editing videos, but eventually this will be up there. But again, if you have any questions, just shoot me an email. Thank you all for being here, and I hope you will join us on April 1st. It's not going to be an April Fool's joke. We'll have Dr. Kathleen Condrey talk about medicinal ads in the Arkansas Echo. So everyone stay safe. Thank you again for being here, and we will see you next month. Thank you all.